character to the shape and bearing of the nose. But we are more than just artists. We have learned to make practical use of these artistic features. There's nothing arty about this nose, but it sure holds up a pair of spectacles. And take the everyday human ear. It can be put to work too. As for the mouth, well, it doesn't take an artist to appreciate this. But there's more to the nose, throat, and ears than all this. These features are more than aspects of personality and character which artists capture on canvas, or by which we recognize the faces of others. From a health point of view, these features have entirely different functions, entirely different appearances. So let's take a look at the nose and throat from your doctor's point of view and see for ourselves the important roles they play in the process of healthful living. The nose, in addition to being a sense organ, is a constant avenue of traffic between the body and the outside atmosphere. Air is constantly entering and leaving the nose. However, the nasal passage is more than just an air tube. Because it is richly supplied with blood vessels, the nasal passage warms incoming air and makes it more suitable to the temperature of the lungs. Your lungs are protected still another way, by the presence of the mucous membrane. This membrane moistens dry air and, if necessary, cools the incoming air. Unfortunately, however, air is not the only substance to enter the nose. Numerous foreign particles floating in the atmosphere may also enter, such as dirt, lint, soot, and bacteria. To protect you against this constant invasion, the nasal hairs at the opening of each nostril filter out most of the large particles of dust and dirt. But very fine particles and bacteria do enter the nasal passage. Once within the nose, these particles and bacteria may be trapped on the sticky surface of the mucous membrane and passed down into the stomach, where they are destroyed by the digestive juices. Let's take a section of this membrane and examine it under a microscope so that we can see how these are actually trapped and disposed of. The surface of the mucous membrane is composed of special cells with hair-like filaments called cilia. Actually, the cilia are constantly in motion, sweeping back and forth in swift, rhythmic waves. When bacteria come in contact with the membrane, they stick to the surface and are swept along by the cilia to the back of the nose and down into the stomach to be destroyed. However, the protective action of this membrane may be handicapped by the indiscriminate use of nose drops and sprays containing oils, which can cause clumping of the cilia. If treatment of the nose is required, see your doctor. The nose and mouth cavities meet at the pharynx. Here, the passage separates into the windpipe, or trachea, and the gullet, or esophagus. At the entrance of the windpipe is the epiglottis, a hinged trapdoor whose function is to open and close the windpipe. Thus, when we breathe, the epiglottis is open and allows air to be drawn freely to the lungs. On the other hand, when we swallow, the epiglottis closes the windpipe, and so foods and liquids bypass this opening and are carried down the esophagus into the stomach. That's why, if you try to talk and swallow at the same time, you confuse your epiglottis, so it doesn't know which way to turn. Food gets into your windpipe, and you cough. This is a reflex designed to protect your lungs from any harmful foreign particles. Other protective organs located in the throat are the tonsils, one on each side of the throat. It is believed that the tonsils are useful in filtering out bacteria that enter the throat. However, the tonsils themselves may become infected, and so become sources of infection to other parts of the body. The removal of infected tonsils often results in the improvement of the general health. From the nasal cavity, small passages lead to the facial cavities or sinuses. There are several such sinuses, each of which is lined by the continuous nasal mucous membrane. In the nasal passage are two additional openings, the eustachian tubes. They lead from the throat to the ears. The function of the eustachian tubes is to allow air to reach the ear from the inside, and so bring about equalization of air pressure on both sides of the eardrum. The ear is a complex organ of hearing. Most of the ear is located within the skull. The outer ear is composed of cartilage and skin, and its function is to gather sound waves and direct them through the ear canal to the middle ear. The sound waves cause vibrations in the eardrum, which in turn passes these vibrations into the middle and inner ears, where they are changed into nerve impulses and sent along to the brain. Because of their delicate construction, the ears must be carefully guarded against injury and infection. Keep your ears clean, but never probe your ears with hairpins or any other object. If you suspect you have wax or other particles in your ear, see your physician. For that matter, periodic visits to a physician are important safeguards against hearing loss. Regular examinations of children's ears especially will help prevent deafness in later life. Hearing loss is apt to occur gradually and may not become apparent until 20 to 30% of the hearing has been lost. Modern science has developed highly sensitive instruments, such as this audiometer, which make possible the diagnosis of the slightest degree of hearing loss. Such tests are conducted not only by private specialists, but by many public school doctors as well. The handicap of deafness has been partially overcome by the development of hearing aids and by instruction in lip reading. Today, most hard of hearing persons are able to enjoy active, useful lives. Although the nose, throat, and ears are separate organs, they are all connected together by a continuous mucous membrane. This membrane also extends into the various ducts and sinuses. This is an important fact to remember. It means, for example, that if an infection should develop in the nose, it may spread quickly to the other organs and cause infection of the sinuses, the throat, and ears. For this reason, even blowing your nose can be unhealthy, if you blow it like this. Blow your nose gently, with both nostrils open, because hard or violent blowing of the nose, especially when blocking one or both nostrils, is apt to force mucus and other matter into the sinuses or the eustachian tubes, and so create the danger of infection in these areas. And while it is quite easy to spread infection within your own body, it is easier yet to spread the same infection to others. Cover that cough. That's better. But now, invisible bacteria are all over your hand. That's right. Wash them off. Make a real effort to protect others and yourself whenever there's danger of passing around a cold. So we have seen that the nose, throat, and ears are more than mere aspects of appearance. They are practical, delicate organs which perform a great deal of hard work throughout our daily lives. They safeguard our health, and when they are not interfered with, will do a pretty good job of their own. But when it comes to foreign matter, deliberately thrust into your ear, or when it comes to applying self-prescribed remedies to your throat, or when you feel like tampering with your nose, don't do it. Don't take a chance. Don't risk injury. Just consider, all the medical literature dealing with the nose, throat, and ears would fill a library. Therefore, see your doctor if you think you're having trouble with your nose, throat, and ears. Don't practice medicine. on yourself.